Good afternoon, and this is Abhijit Nandi Mazumdar. Welcome to A&M News, and we are going through a very, very critical phase as far as the coronavirus is concerned. No end in sight. New cases are ever rising, not only in India, and although there are claims of vaccines being invented, Italy claimed, Israel claimed, Germany is claiming, but then there are no specific indicators that they have been successful. So where does this all lead to? Well, that's a big question mark. But the moment, let's find out from where it all started. And I have with me a very, very different person. Dr. Akash Aboti. Dr. Akash Aboti is a part, he's researching with his professor who was a part of the Wuhan lab, and he is a part of that entire team researching on the outbreak of coronavirus and how it can be controlled. Who's Dr. Akash Aboti?
Hello, nice to talk with you.
Yes, Dr. Akash, now where is this coronavirus? How and where did this coronavirus originated? There have been a lot of theories floating around, but what is your research? Because you have been connected directly with the laboratory which has been doing this research. So where has this coronavirus started, developed first?
Yes, I can surely tell you that thing. Actually, I work in Guangzhou, and the professors from Guangzhou and different parts of China were invited to Wuhan to take care of this situation and to control this virus and everything. So what exactly happened with their research is, at the beginning, they were not aware how did this virus came from, or what exactly it is, or how we can help it out. Even they were same as other parts in the country, in the world. So they started a research what exactly it might happen or what it is from. In the beginning, they found like 7 patients suffering from pneumonia, a severe pneumonia. They started treating them with different kind of pneumonia treatments, different kind of pneumonia antibiotics. But the patients didn't recover, and all 7 of them died. So the government, the hospital, the doctors thought this is not only pneumonia, this is something more than pneumonia. Then they started their research, and in their research, they came out with that there is a new virus outbreak. Same thing which happened in 2003 with China. In 2003, SARS-1 was outbreak in China, but it was not spread all over the world. The reason behind it being is in China right now, when it was outbreak, the outbreak was started. It was New Year time. It was on peak of New Year preparations. And that is the most important time of China. What exactly happens in this time is Chinese people go on off duty for more than 45 days or around 45 days. So everyone traveling from here to there to there, or the people from abroad settled in China, they will go back to their countries and all these things. This was the reason why it was not able to be controlled. And as soon as they diagnosed that this was a new virus, they started a research how it came into existence and all those things. Actually, Wuhan, for your knowledge or to tell to the viewers, I can say Wuhan is a large seafood consuming place. The people over there eat a lot of seafood, and in some research they found that this virus came through bat, but bat is not a seafood. So actually, then they did the research and everything. In their research, they found out that the bat was in connection with some of the sea snake, and this sea snake was eaten by the people over there, and that's how it came into the human being. That was the most important thing I can say in this scene. Whatever different countries or different people are claiming, I don't think all these things are correct.
So your research and the entire research points to the fact that it came from infected bats, and bats not directly from the bats to the seafood, and from the seafood that is eaten by the people of Wuhan, that's how they got it, and it spread from there. That is what exactly happened as far as the origin of coronavirus is concerned. right?
Right. Right.
Okay, great. So from there, when this thing spread from the bats and the seafood from Wuhan, it spread
Hmm.
to rest of the country and then to rest of the world. Now, where do we stand at the moment? There are a lot of people, because you have been doing this research, so you know this virus originates from the bats. And now Italy has claimed that they are a vaccine. Israel has said they have made a progress. Germany has said there are progress. Plasma therapy is one that has been talked about. Then microbacterium W is being talked about as generating immunity. So where does all these things stand vis-a-vis this coronavirus?
Yeah. In all these things, we made a treatment protocol. We means my professors who are working in China. They made a treatment protocol. What treatment protocol should be followed for the patients who are suffering from COVID-19? So what exactly happened in this is when they were researching and they were treating the patients in all the scene, the patients were treated with different kind of protocols. Finally, they came up with a final protocol which have three different categories. In one category, that is medication, what whole world is using right now, that stands with loponavir, ritonavir, and remdesivir. Now, you might have heard in these days, remdesivir is one of the medicine which is declared by Japan and USA that this is the most effective medicine for the coronavirus patients. So this they are giving by the day one. They are trying and they are passing on the knowledge that yes, this medicine can be worked, this medicine can be worked or used or so on. And the second category was plasma therapy, what we already discussed on, or everyone in India knows that we are doing it in New Delhi, in Mumbai, we are practicing that therapy. But yet we have to practice one more therapy that is not so expensive, not so tough, and that is oxygen therapy. What exactly is done in oxygen therapy is a liquid oxygen is supplied directly to the lungs of the patient, and that helps the patient to recover from all kind of coronaviruses, I can say, because as you might have heard that the coronavirus is different in different places. The virus came from Spain is different, the virus came from China is different, and the virus we found in India are different. All these viruses are of different categories, features. So all kind of features are covered with oxygen therapy up to their research, what I can say. So now we have to start in India on a mass level. I can say we should do oxygen therapy to control the deaths. That would be the really big thing, big outbreak for us to treat the coronavirus patient, and we can recover. We can like save a lot of deaths in this.
Great. So no, one question that I want to ask you here is that you are propagating the oxygen therapy. Oxygen therapy, can this oxygen therapy be done at home? B, can a patient sizably recover? I mean, not very severe patient, mild and a little more than mild patient. Can that patient recover through oxygen therapy?
Yeah, the patients can recover through oxygen therapy, but they cannot do this therapy back home because, as I said, a liquid oxygen should be insulted. It should be put directly to the lungs, and that cannot be done back home. So the
So,
patient needs a procedure.
So in that case, it needs to be done in hospital, in the hospital. So patient needs to go to a hospital to get this type of treatment done.
Definitely.
Okay, so that is the most oxygen therapy and remedial, the other drug that you have mentioned just now.
Remdesivir. Yeah.
Okay, these two are the most so far the most used or the most known drug or a
Treatments.
therapy that can cure coronavirus. That's what you're saying.
Right. I can talk more about plasma therapy. Now we are doing plasma therapy for all kind of patients in India. But actually, plasma therapy is effective only for the patients who fall in between the age range of 15 years to 50 years. Not more than 50 years patients can be recovered with plasma therapy, and it is also dangerous for that kind of patients to donate plasma as well, to receive plasma as well. So, what my suggestion would be is our country can take plasma therapy, give plasma therapy to only patients who fall in between the range of 15 years to 50 years. That
But
would
then, Dr.
help our
Akash, there is a big debate going on in India stating that somewhere plasma therapy is successful and somewhere it is not successful.
uh, yes, definitely it is. Because as I said, plasma therapy is effective, but not effective for all the patients. It depends on the patient's condition. It depends on the patient's situation. What is the patient's situation right away? And then we can do plasma therapy. You need to consider, it is a clinical saying that you need to consider first what results you will get with the patient.
So, Dr. Akash, is plasma therapy more effective or the oxygen therapy?
I can say oxygen therapy is more effective
And,
as per the research done in China until now.
and oxygen therapy can be given to any age group.
Yeah, age group doesn't matter much in oxygen therapy, but you cannot do that back home as you asked me before.
That I understand. So, age group doesn't matter in oxygen therapy. And what is the percentage of recovery in oxygen therapy treatment?
As per their research, it says 70 to 75% is the recovery rate in that oxygen therapy, and that is really a big number.
So in that case, if a person is of the between the age group of say 20 to 65, 70, in that age group, if you put oxygen therapy treatment, then there are very, very high chances of a full-scale recovery.
Definitely, it is. So I can say it can be a new outbreak for Indian government or for Indian doctors to perform oxygen therapy, a high dose oxygen therapy.
So what is the procedure?
You need to perform a high dose liquid oxygen, and you need to directly make it reach to the lungs. It will be very clinically. It would be very clinical if I explain everything how to insert the oxygen inside. So I don't think your viewers need that thing. Right now,
Right.
I made a PPT related to this, and I'm forwarding it to everyone, whoever doctors are in my contact, or I also forwarded it to PM office. So I am doing my job from my end. So I think now it's the time of government and the doctors who should perform this therapy.
So in this under this situation, Dr. Akash, is oxygen therapy very expensive?
No, it is not. It is actually not so expensive. As compared to plasma therapy, it is actually not. If you want to do a plasma therapy, it is actually expensive, but not oxygen therapy. You just need a liquid oxygen to perform the therapy. That is
And
on mass scale available in all kind of hospitals.
absolutely. And how long does this treatment take? How much of an oxygen? What is the period?
Like it may take 7 days for few patients, it may take for 14 days for few patients, but safer side, a patient need to stay in hospital for 7 to 14 days. That is also an incubation period for COVID-19. The reason behind it is if a patient is again suffering from COVID-19, can be like reoccurrence, I can say, can be diagnosed in hospital itself.
So oxygen therapy is the new mantra, the new dose for recovery of a coronavirus patient, irrespective of his age, irrespective of the status he is in, whether it is minor, major, mid, or severe coronavirus attack, and it can be performed on anybody and is not very expensive. The only thing is that you need to go to a hospital, and the time period that is taken is usually between 7 to 14 days. That's what you're saying, Dr. Akash, isn't it?
Right, it looks like that. It is not very new, I can say. Even before we performed this kind of therapies in India in different kind of diseases related to lungs, we performed this therapies. It is not so new therapy, or it is not something like we never performed this therapy before or something like that.
Do you, in such a situation, my last question will be, do you require to know the status of the lungs, whether the lungs is in good state or in extreme bad state?
You need to. You need to clinically evaluate the patient if that patient can receive oxygen therapy or not.
Okay, and what do you think are the percentage of in coronavirus cases? What do you think the percentage of patients will be able to take, what percentage of patients will be able to take oxygen therapy?
If I can talk about patients, even now in India, the death ratio is around 4%. 4 to 5% patients are dying due to COVID-19 who are diagnosed. And that number is really high. I can talk about Thailand. Thailand is a small country, right? And it has the maximum number of traveling people, the tourism. But still, Thailand is recovering very fast. The ratio in Thailand is just 1.8%. Can you imagine that?
True.
So
So
we need to.
Are they using oxygen therapy there in Thailand?
They are also using oxygen therapy. They are also using medication therapies, what I spoke about before, and they are also using plasma therapies as well. You need to combine all these therapies to get a good result.
Okay. Right, doctor. So, very, very important thing that you suggested. It's a very wonderful deduction, and it's going to be good news for a lot of people. Oxygen therapy can cure coronavirus, irrespective of severity, irrespective of age. That's a new finding at the moment. Things are coming from various quarters, but this is a definite new finding, especially coming from a place where a lot of research has taken place, coming from a place where the coronavirus originated. Thank you very much, Dr. Akash, for sharing all this with us. And I'm sure this has been a great learning lesson, very educative lesson, not only for all our viewers, but also for us in the ANM News family. And we have also come to know about this, and I'm sure this will be more utilized. And for us, it's been an absolute eye-opener. Thanks a lot for your time, Dr. Akash Aboti. Thank you very much, and we'll keep coming to you later for further details or if there are any developments. Thank you, Dr. Akash.
Thanks a lot. Thanks a lot. Yeah.